want to talk to you about the physiological process of birth. So how does birth happen? For some women in the United States, the experience may go something like this. The woman starts having painful contractions and knows she's in active labor, so she heads to the hospital. She gets admitted to labor and delivery, but because she's only 3 centimeters along, she starts off with some medication, Pitocin. This will help her contractions be stronger and longer to really start things going. Once she's on Pitocin for a few hours, she has started showing signs of dilation or progression, but the pain has also been intense, so she asks for an epidural. The epidural may start to halt or slow down her progression, but she endures and is relatively comfortable through this period. After many hours where she's probably confined to the bed, it's now time for the pushing stage to start to begin. She's coached when to push and how to push, and eventually her beautiful baby is born. Now, this isn't a terrible way to birth, but we want to explain to you how your birth could be different. Your body was designed to birth. The natural process is so complex. And when you start to learn and examine all of the subtle intricacies of birth, you start to have a huge respect for the process, for your body, and for your baby's participation in labor. There are physical and physiological changes that occur in your body long before the due date or the day that your baby is born. When your baby is ready to be born, they will release a protein into your amniotic fluid or your bag of water. This is the signal that their lungs are ready to start breathing oxygen. This signal stimulates contractions in the uterus. Many of you mamas watching here, if you've had a baby before, you're now remembering those sensations. The woman's cervix begins to thin and open, a process which has been progressing for quite some time, but now is effective. With the cervix beginning to dilate, the pressure of the baby's head continues to create contractions that are progressive. It's possible, if the bag of water hasn't ruptured at this point, that some of those contractions may cause the bag of water to break. Throughout pregnancy, relaxin, a hormone in your body, has been increasing, which softens your cartilage and allows your pelvis to spread and open for the birth process. The cervix keeps transitioning, and at 10 centimeters, the body is flooded with a wave of endorphins. Your contractions continue to increase in their duration and in their intensity. But with this gradual build, the body has also been producing natural endorphins that act as neurotransmitters to the nerve cells to stop the pain you are experiencing. The natural endorphin level will rise to match the pain sensation that you're feeling. You have a built-in epidural in your body. Sometimes the failure to release these endorphins might allow the pain to occur. So if you have pain medication or something that is augmented in your body, then your natural endorphins may not be as strong trying to match those sensations. This is why some women will describe a failed epidural as a very painful experience, because their endorphins have not been rising naturally to meet the pain sensations. If stress or fear are present in the woman's body, then the hormones that usually help the body progress are now constricting the blood to the uterus, and they're prolonging or halting labor. If a woman feels safe and secure in her birthing environment, her body will naturally progress and take on labor. At 10 centimeters, the body is now feeling alert. There's an excessive amount of adrenaline that is released with that achievement. Now, even though a cervix is fully dilated at 10 centimeters, the sensation to push may not yet be present for a woman. This is called a resting stage, and often it is a gift given so that the mother can rest briefly before it is the time for her to push. In the meantime, her hormones are continuing throughout her body and preparing her baby to experience extra amounts of adrenaline. So they'll be alert and awake, excited to breastfeed once they're born. When adrenaline, endorphins, and the oxytocin levels peak, the body is ready to push and will start to work alongside your baby for the grand event. The baby then maneuvers a complex shape of your pelvis, and with each push, they twist and turn through the birth canal. As the head crowns, the vulva begins stretching to accommodate the size of your baby's head. The baby will typically emerge face down, but then will start to turn their shoulders so they can wiggle their way out. The baby's central nervous system reacts and they take their first breath. When a mother's body experiences this cocktail of hormones, there is an ecstatic release after birth. I've experienced it myself and can tell you that it is ecstatic. For anyone who is considering having an unmedicated labor, we know that your body was designed to birth and will allow you to have an experience in such a way that is invigorating and empowering for you.